You can make a difference and even save a life if you know the signs and symptoms of a stroke. The acronym FAST, F-A-S-T, alerts the public to the frequent signs and symptoms of a stroke. The letter stands for F, facial drooping, A, arm weakness, S, speech difficulty, and T, time to call for assistance. A stroke occurs when the supply of oxygen to the brain is cut off or reduced. An ischemic stroke results from an obstruction such as a blood clot. A hemorrhagic stroke occurs when broken blood vessels cause blood to leak into the brain. Sometimes strokes occur from a blood vessel in the neck being damaged from trauma, causing a clot to form that travels to the brain. This is known as a cervical artery dissection or vertebral dissection. Here in more detail are some of the most frequent signs of a stroke. Sudden numbness or weakness of the face, arm, or leg, especially on one side of the body. Sudden confusion and/or trouble speaking or understanding. Sudden vision impairment in one or both eyes. Sudden difficulties walking, dizziness, or loss of balance or coordination. Sudden onset of a severe headache with no apparent cause. Medical professionals use the saying, time is brain, because accurate diagnosis and speedy treatment are vital to reducing the long-term effects of a stroke. But unfortunately, there are some emergency departments which are not properly staffed or where staff are not properly trained. In some cases, emergency room staff or other medical personnel, including those at urgent care centers, may overlook or even ignore the warning signs of a stroke. Medical malpractice can occur if providers fail to take a proper medical history or fail to conduct a proper and thorough physical examination. If they fail to order proper diagnostic studies like a CAT scan or MRI to pinpoint the blockage. If they improperly classify the stroke as another medical condition which results in delayed or improper treatment. If they fail to administer blood thinning or anticoagulant medications to the patient to prevent a stroke in patients suffering from a heart condition known as arterial fibrillation or Afib for short. Failing to administer a clot-busting medication known as TPA, an FDA-approved clot-busting drug with the ability to stop the progression of a stroke if timely given after the onset of stroke symptoms. Or failing to surgically remove the clot through a procedure known as an embolectomy. When the signs and symptoms of a stroke or impending stroke are missed, ignored, or improperly responded to by doctors, urgent care facilities, and hospitals, the patient loses the chance for a good recovery. Failure to timely diagnose a stroke or start emergency treatment, our law firm can assist. And you could get further information at brainlaw.com/medical-malpractice /stroke-misdiagnosis/. Thank you for joining me today, and I look forward to seeing you next week on another edition of the Brain Injury Insider.